nurse, I was approached by a young lady who was wondering how she got pregnant with her 2-year-old son after taking emergency pills correctly. I've also done research and found out that a lot of ladies are having babies they got after emergency pill failure. That's why I have come out with this topic of today as reasons as to why emergency pills fail to work. So today I'm going to be telling you 4 shocking reasons as to why emergency pill can fail to work. I'll also be revealing the best emergency pill that cannot fail to work. I'm called Sarah Dong. I'm working with the Comfort Home Nursing Care Services. It's a group of medical professionals. We do bedside nursing to patients at the convenience of their own homes. And our services include post-surgery and wound care, elderly nursing care, stroke recovery, palliative care, early discharge from hospital, physiotherapy, nursing consultations, dementia care, cancer care, and diabetic care. If you're interested in our services, please contact us on our details running on the screen. Alright, let's go to the topic of today as why emergency pill failed to work. First and foremost, let me tell you the definition of emergency pill. Emergency pill, these are medicines that are taken by women to avoid pregnancy after unprotected sex. The following are the types of emergency pills that are existing: Postina, Revoke, Lydia, Backup, Plan B, etc. Meaning the list is endless. So, who is supposed to take emergency pill? Emergency pill is supposed to be taken during accidental sex, meaning someone who has had unplanned sex. Also, it should be taken by someone who has been raped, or it should also be taken by someone who is already on family planning but makes a mistake or does not use the family planning method correctly. For example, you are using a condom and then accidentally the condom breaks. If you don't want to get pregnant after a breakage of a condom, you should use an emergency contraceptive pill. Also, for people who are on injections, that is injector plan, a 3-month family planning method, if you miss to use it for about 2 weeks after the last injection and you have unprotected sex, you should go and take emergency pill. Also, for someone who is taking the daily family planning pill that is taken daily for a month, if you miss for 2 days without taking it and you have unprotected sex, you are supposed to take an emergency pill in order to prevent you from getting pregnant. So, how do you take this emergency contraceptive? How do you take this emergency pill? Emergency pill is supposed to be taken within 72 hours. That is about 3 days. It is also supposed to be taken immediately after unprotected sex to avoid the pregnancy. So, if you check in the emergency pill box, it has 1 tablet. It means you are supposed to take that 1 tablet and that is a full dose. If you get 2 tablets, it means you take the first tablet immediately after unprotected sex and the next tablet you take it after 12 hours. Emergency pill is not supposed to be taken before unprotected sex. If you take it before sex and then you have sex, it will not work. Also, you should not be fooled by the name of morning after pill. If you have unprotected sex, you're supposed to take the pill immediately. Don't wait for the following morning to take the pill. If you have access to the pill, please take it immediately for the effectiveness. So guys, let's go to the shocking reason as to why emergency pills fail to work. Reason number 1, your body type. The body type here, I mean the body mass index. When the body mass index or your weight is a little bit higher, emergency pill only work up to a certain body weight. That is up to about 70.3 kilograms or 155 pounds. When the weight goes beyond that, the effectiveness of the emergency pill also reduces as weight goes up. So when you are a little bit overweight than 70 kilograms, here I would advise you to talk to your doctor to either double your dose or there's a better emergency contraceptive, that is the IUD, that cannot fail, that can work for you when your weight is a little bit higher than 70. This is what research has shown, that when your weight is a little bit higher than 70 kilograms, emergency pill will become less effective. Therefore, chances of you getting pregnant is very high. Number 2, wrong timing. Emergency pill, the trick behind using emergency pill is correct timing. If you do the correct timing, that is taking your emergency pill immediately after unprotected sex, and also considering taking it within 72 hours. That's about 3 days. If you take it within 3 days, emergency pill will work for you correctly. But if you forget and then you take it on the 4th or 5th day, the emergency pill will not work for you. Or if you take it before the unprotected sex, that I already mentioned earlier on, if you take it before unprotected sex, the emergency pill will not work for you. So endeavor to take emergency pill within 3 days or within 72 hours, and the earlier you take it, the better for you. Number 3, ovulation. When you take emergency pill during your ovulation or when you've already ovulated, it will not work simply because of the mode of action of the emergency pill. Emergency pill is meant to delay ovulation for a period of time or for a number of days, like 3 to 5 days. It is meant to delay ovulation. But what is ovulation? Ovulation is the release of a mature egg from the ovary of a woman for fertilization. So when ovulation has already taken place, or when you take the medicine during your ovulation, it means the egg has already been released and it can easily meet the sperm, and fertilization is going to take place. Therefore, you'll end up getting pregnant. So I would advise during your ovulation, please use a different type of emergency pill, preferably the copper T or the IUD. It will be able to work for you. The last reason is medication. There are certain medications that counteract with the work of emergency pill. When you're taking the following medications that I'm going to tell you, for example, CPZ, that is chlorpromazine. It's a drug that is used by epileptic patients. Rifampicin is an antibiotic that is used for treating TB. Grucifulvin is an antifungal medicine. All these drugs counteract the work of emergency pill. If you're taking these drugs and you take emergency pill, be sure that emergency pill will not work. It will not prevent pregnancy. So the best thing to do here is you should choose either to use a condom during sexual intercourse, because you cannot stop using the above medication. If you're already on it, you have to continue using your medication. Please don't stop in the name of wanting to swallow emergency pill. You can use any other preventive measures like condom, or you can use a copper T, which is the best that can help you to avoid the pregnancy. So the best family planning method that can work for you in all seasons, that cannot fail you, it is 99% effective during prevention of pregnancy, is the copper T, that is the IUD. It is a prescribed drug. You cannot buy it over the counter. It is a prescribed drug that you have to go to hospital and it is inserted. But the beauty about the copper T is it can actually work for you up to a period of 5 days. If you've forgotten to take your emergency pill and you realize maybe on the 4th or 5th day, please run to the hospital and let it be inserted. It will help you to avoid pregnancy. It is very effective and it is the most effective drug that you can use to avoid pregnancy. Copper T is an effective emergency contraception, but it can also be used as a family planning method. So after putting the copper T, after the doctor inserting the copper T, you can either choose to leave it there as a continuous family planning method, or you can remove it after it has performed its work as an emergency contraception. Another thing to add on, emergency contraceptive pill cannot cause an abortion. So when you take it when you've already conceived, it will not cause an abortion. It is also not a family planning method. It's not a continuous family planning method. It is supposed to be used in case of an emergency only. That is how the manufacturers have made it to be used as an emergency contraceptive. It is not supposed to be used as a continuous family planning method. That was all I had for you guys today. Please subscribe to this YouTube channel. Don't forget to turn on your notification bell and share to your friends so that we all get the healthy tips from this channel. See you in my next video.